pandemic has clearly been the elephant in the room. You can't disentangle COVID-19 from the broader healthcare system and the administration's healthcare agenda. Certainly that's taken up a lot of the oxygen in the room, so to speak. That being said, more narrowly, I think when it comes to healthcare, you put your finger on it at the outset by saying that shoring up the ACA, strengthening the ACA is the overarching healthcare priority on the coverage side for the administration. Biden campaigned on being against Medicare for all and against the single payer approach, but in favor very much of building on the legacy that he and President Obama had put into place, as you know. At the same time, drug pricing is probably the most overarching hot button issue that resonates with voters, and also can help pay for the more ambitious elements of his broader healthcare and domestic agenda. So we think about the healthcare agenda at the moment as being largely still COVID-19 driven, getting us out of the pandemic. If they can get some traction on a skinny BBBA proposal, one that is principally focused on messaging around inflation and deficit reduction, and they would primarily make changes to the tax code to raise revenue. Most likely, you will see climate, so policies to address climate change, in addition to tax changes, be the centerpiece. I think drug pricing becomes the third leg to that stool as an important pay for. And when we talk about drug pricing, our assumption is that the three policies that were in the original BBBA, Medicare negotiation, inflation rebate penalties, and Part D redesign, would continue to ride with a skinny BBBA. One, because they're politically popular. I mean, those policies are not the ones where there was discord among Democrats, really, at least not to the final version that they aligned on, and also because they save a lot of money, at least, about as much as any other pay for. And it will be hard, even with a skinny BBBA, to ensure that the costs are offset. And they're saying they want to go deeper than just offsetting the cost. They also want to contribute to deficit reduction. So on the pay for side of it, it means you still need a hefty package of offsets. And most likely that comes from taxes and drug prices.